Hi, my name is Lydia and I'm an occupational therapy student, and today I'll be showing you how to properly don and doff PPE equipment as well as some different precautions that can be addressed. So to start out, I'm going to first be showing you how to put on the equipment. And so what we first will be starting out with that you'd want to put on first is your gown. And you kind of want to put it on the opposite way you would do a jacket. So you want the closed side to be in the front, the open side in the back. So you just put it on this way. And then you want to make sure that you tie the waistband good. And then once you get the waistband, then you also have this necktie up here. These two strings on the end. There we go. So you just want to go ahead and tie those as well. Make sure it's nice and secure and covering your whole front, and that it's just secure in the back. And then next you would put on your mask like this, and you want to make sure that it is fitted to your nose so no particles are coming in up top, and that it's pulled down all the way as well. And I'll just pull this down for right now. But then if you had a face shield or goggles, you would then put those on. But I do not have that. And so the next you will put on gloves. And when you're putting on your gloves, you want to make sure that you have it down your wrist so no skin is exposed. You can make sure that you tuck your gown up under them so that no skin is being exposed. Like this. So this is what it looks like completely on. So now when we want to remove our PPE equipment, you first will start with removing your gloves. So what you will want to do with your first hand is pinch it here at the palm. You'll just grasp it and take it off. And you want to make sure that you're only touching clean to clean material, and as well as only dirty to dirty material. So to prevent touching my clean hand to the dirty glove, in order to take this off, I'm going to slip my finger up under the glove and remove it that way, making sure that this dirty palm with the dirty glove does not touch this hand. And then fold it inside of itself like that. And then you will discard that. And then next I will be removing the gown. There's different ways to do it. You could have pulled it off while you still had the gloves on, but instead I'm going to reach behind without making sure I touch anything dirty to anything clean, because this whole front side of me is contaminated. I'm going to untie these, and now I'm touching only the inside, and that's the way I'm going to remove it. I'm going to pull it down, kind of making it backwards like this, and kind of fold it inside out like this. And then I would discard of this as well. And now for my face mask, I'm gonna again not touch my clean hands to my dirty mask. I'm going to grab back here behind at the strands and remove like that. And another thing, after removing all PPE equipment, you would want to make sure that you either wash your hands or use an alcohol-based hand sanitizer immediately after removing all equipment. So now that we know how to properly don and doff our PPE equipment, I'm going to be talking about some of the ways that these infectious diseases can be transmitted, as well as some of the precautions. So first, to start out, there's 3 different ways that these things can be transmitted, through contact, droplet, as well as airborne. Basically, contact is just when there's direct contact, which would be going from person to person, and then there's indirect contact, which would be germs from me getting onto an object and then a person coming along and touching that same object and it being transmitted that way. There's also droplet, which is when transmission is being given through somebody coughing, sneezing, talking, anything such as that, and then those particles coming into contact through somebody's eyes, mouth, anything such as that. And then with airborne, these are just when particles are being transmitted into the air, and then they tend to linger and stay there. And then other people may come around and inhale those particles. An example of a contact transmission that you could see in a healthcare setting is MRSA. And for this, you would want to have your gown as well as your gloves on, and you would want to have these on before entering the room, and then you would want to doff them before exiting the room. And also any equipment that you may bring into the client's room for that day for them to work with. If it's something like a TheraBand, you could leave it in the room with them. But if it's, an equipment that the facility only has one of, you would want to potentially take it out with that same glove that you have on, immediately remove it, take it to the therapy gym or wherever, and take it to be sanitized immediately. An example for a droplet transmission would be influenza, and with these clients you would want to have a mask worn at all times, especially since we're going to be in such close contact with them. And then of course, if the client is leaving their room and going throughout the facility, you would want them to be wearing a mask as well. And then an example of an airborne transmission could be a client that has tuberculosis. And with these clients, you would wear a mask or an N95 mask if there's one available. And again, with these clients, if they are exiting the building, you would want them to have a mask on. And typically, these clients could be in rooms where there's this negative airflow, and that helps keep the pressure inside. So that's also a possibility for these clients. So beyond just washing our hands and using protective equipment, there are ways that we can prevent transmission from occurring. And with contact transmission, with this we can make sure that we're being mindful of sanitizing our client's environment, as well again as with any equipment that we may be using with them, especially if we are taking that equipment out of their room and taking it anywhere else, that we're immediately getting it sanitized. And then an example of a way to prevent transmission in droplet form would be to teach your client respiratory hygiene. So this could include teaching them to cough or sneeze into their elbow, or if they have a tissue, coughing and sneezing into the tissue and then immediately disposing of that tissue. And then an example of a way to prevent an airborne transmission would be to potentially use a air purifier in a client's room, and if used properly, this can help prevent the spread of that airborne illness into the surrounding air.